Hi, I'm Sara Petruska. I am a generalist obstetrician gynecologist and the medical director for labor and delivery at the Center for Women and Infants with U of L Health. From when I was very young, I knew I liked science, and so I actually tried doing research for Pfizer, for a drug company, when I was in college, and that helped me figure out that even though I liked science and the scientific process, I also liked being around people. And in a lot of research jobs, you don't get to be around all different kinds of people from all walks of life, and I missed that. So that's kind of how I landed on medicine as a way that I could work in the sciences, but in a way that brought me into concert with a bunch of other people instead of keeping me locked away in a lab. I do inpatient and outpatient obstetrics, and I do outpatient women's health. So in my outpatient world, I take care of patients who are perfectly healthy and need their preventive health maintenance. I have a clinical interest in abnormal pap smears and colposcopy, which can let us diagnose the stages of pre-cancer of the cervix so that we can treat that and prevent a cancer from ever developing. And then contraception and abnormal bleeding and infections, so all outpatient women's health. And then my inpatient practice is really obstetrics. So when I'm on call, I'm on labor and delivery, which is the Center for Women and Infants. And we take care of everything from the very lowest of low-risk pregnancies to really kind of the highest risk stuff that can happen. I think that the patient is in charge, and our job, we have expertise and we have experience, and our job is to lay out the different options and be the patient's guide in choosing the one that's the best fit for her. And I think the patient's the ultimate authority on that. When I look at a menu of different options and they're all equal in how well I think they'll meet the patient's goals, then that's my job to communicate that to the patient. And if I see one that's definitely closer to meeting what the patient is looking for, it's my job to point that out. But I think our role is not to be in control, it's to counsel the patient on the different options that are in front of her. We do a lot of vaginal birth after cesarean delivery at the Center for Women and Infants. A lot of hospitals don't do that because there's some risks to the patient. And there's some requirements about the resources that a hospital needs to have, and we have those. And because we're staffed to have all those resources that a patient would need, that's one of those situations where we can lay out the options and help the patient pick the one that fits for her. And I think what we do is also look at the other part, which is the value to the patient if she does have a successful vaginal delivery, which is something that only the patient can tell us. So I think we do a good job of counseling patients on their options and then supporting them in their choice. I have 2 kids. They're both very active in different hobbies, so we do a lot of driving around for them. I like to work with my hands. That was another part of why I chose this specialty, because I like the relationships that we get to build with people, but we also get to do procedural stuff, which is fun for me. And I've always liked to do stuff with my hands. So woodworking, pottery, sewing, crafting, all that kind of stuff.